Natural methods. The Pearl Index of the Billings Method is 2 to 20, and for the Withdrawal Method is 15 to 30, and for the Lactating Amenorrhea Method is 0.5 to 2. This table gives the advantages, disadvantages, side effects, and contraindication to the natural method of contraception. So the advantage is that Catholic churches accept the natural method. The disadvantage is that there is no STI protection. There is variable menstrual cycle. That means it's difficult to determine the fertile days. And 3, the withdrawal sperm. For the withdrawal method, sperm may still be present in pre-ejaculatory fluid. And there are no side effects of the natural methods and no contraindications for the natural method. Now, the basis of the rhythm method. The ovum can only be fertilized for less than 24 hours after ovulation, and sperm can only survive for 2 to 5 days only. Basal body temperature. BBT stands for basal body temperature, and this needs to be charted for a few cycles first. Now, the Billings method. Before ovulation, the mucus is thinner and more penetrable by the sperm due to estrogen. It's thick and impenetrable after ovulation due to progesterone. The lactating amenorrhea only can be used for up to 6 months postpartum. If any periods start before use, an alternative contraception must be used. Good info, know this. For motivated women, Rupert Singh says that changes in the cervix during the cycle is observed. So after menstruation, the cervix is lower in the vagina, firm in texture, and the os is closed. As estrogen secretion increases, the cervix moves upwards, becomes softer, and the os begins to open until at ovulation it will admit a fingertip. After this, there is an abrupt reversal due to high levels of progesterone. Note briefly, there are 3 primary fertility signs for women practicing fertility awareness, and these include basal body temperature, cervical mucus, and cervical position. The secondary signs include abdominal pain and heaviness, back pain, breast tenderness, and Mittelschmerz. So I have to look up what Mittelschmerz means. Now, the barrier methods, we have condoms, that's female and male condoms. The Pearl Index for condoms is 3 to 14. This table gives the advantages, disadvantages, side effects, and contraindications to condom barrier methods. So, first advantage, it protects against STIs, but there are some exceptions. 2, we know the exceptions, for example, HPV and herpes. 2, there is decreased cervical cancer incidence, but not completely, as HPV can still be transmitted with a condom. A disadvantage is that if the person is allergic to latex, they will have an allergic reaction. Another disadvantage, the partner needs to comply. It gives less spontaneity, there is less pleasure, and the persons need to be careful on withdrawal. For female condoms, it's noisy and there's crackles during sex, and persons and you need a higher learning curve for use of female condoms. I'm guessing this is saying that persons who have disability, mental disability, or they they won't be able to understand the instructions for use. They'll be disadvantaged if trying to use the female condoms. Side effects: if the patient is allergic to latex, if an alternative is to use polyurethane or plastic condoms. There are no contraindications to condom usage. Now, the diaphragm. The Pearl Index is 6 to 20. It's fitted before sex and must remain at least 6 hours after sex. The advantages, they don't know any advantage. Disadvantage, it's cumbersome. There's lack of spontaneity. UTIs are more common. You need to use trained personnel for snug fit, and there's a risk of dislodgement. Side effects: UTI. Contraindications, there are none. Now, the intrauterine contraceptive device did not mention the Pearl Index, but well, yes, it did mention the Pearl Index. The Pearl Index for copper is 0.6 to 0.8 per 100 women year in the first year of use. For Mirena, it's 0.1 per 100 women years, and it's most effective reversible method of contraception. The Mirena contains 52 milligrams of levonorgestrel and 20 urograms is released daily. We must know about the insertion procedure very well. We should not touch the device because it's an aseptic technique, and the timing of insertion, such as the interval, the post-abortal, and the postpartum insertion interval. So, the Mirena insertion video is shown in this YouTube link. It demonstrates and explains the Mirena insertion. This table seems like it was taken from Toronto Notes, Table 11, IUD Contraceptive Methods. It gives the mechanism of action, side effects, and contraindications to the contraceptive device. Now, the copper-containing IUD, that is the Nova-T, is a gives a mild foreign body reaction in the endometrium, which is toxic to the sperm and alters sperm motility. The progesterone-releasing IUD, that is the Mirena, gives decidualization of the endometrium and thickening of the cervical mucus and has minimal effect on ovulation. It is highly effective, 95 to 99% effective. Failure rate is 0 to 1.2%. The contraceptive effects last for 5 years and is reversible. Patient has privacy and is convenient. It may be used in women with contraindications to oral contraceptive or who want long-term contraception. The side effects to intrauterine contraceptive device such as copper and progesterone is that you can get breakthrough bleeding, you can have expulsion, 5% in the first year, and the greatest risk is in the first month and in nulliparous women. You can also get uterine wall perforation. 1 in 1,000 women will get that during insertion. If pregnancy occurs with an IUD, there's an increased risk of ectopic pregnancies. There's an increased risk of pelvic inflammatory disease within the first 10 days of insertion only. In terms of the copper IUD, there's an increased blood loss and the duration of menses, as well as increase in dysmenorrhea, or you may get dysmenorrhea with the use of copper IUD. For the progesterone IUD, patient can have bloating and headache. Absolute contraindications for both the copper and progesterone IUD is if the patient has known or suspected pregnancy, if the patient has undiagnosed genital tract bleeding, if the patient has acute or chronic PID, or if the patient has lifestyle risk of STIs. A contraindication to the copper IUD is if the patient is allergic to copper, or if the patient has Wilson's disease. A relative contraindication to both copper and progesterone IUD is if the patient has valvular heart disease, past family or past history of pelvic inflammatory disease or ectopic pregnancy, the presence of a prosthesis, abnormalities of the uterine cavity, intracavitary fibroids, cervical stenosis, or if the patient is immunosuppressed like a patient who has HIV. Another relative contraindication to only the copper IUD is if the patient has severe dysmenorrhea or menorrhagia. Cervical swabs for gonorrhea and chlamydia should be done prior to IUD insertion. Roop says to reduce the risk of infection using the copper IUD, they clean the cervix thoroughly, cut the string very short, and give them antibiotic coverage, that is, augmenting for 3 to 5 days after insertion of the device. Complications of using the copper IUD include infection, which is most common in the first 20 days post insertion, and this is due to the presence of an already existing STI being transplanted. The IUD itself, being in situ, does not increase the risk of infection. 2. The patient might have menstrual disturbances. The copper IUD increases menstrual flow. The Mirena decreases and may actually cause amenorrhea. 3. Perforation. 4. Expulsion. 5. Pregnancy and ectopic pregnancy. The risk of ectopic pregnancy is 80 to 90% less than in a patient who does not use contraception. However, if pregnancy does occur, it's more likely to be ectopic than a normal pregnancy. Now, notes on oral contraceptives. The combined oral contraceptives or the progesterone only have similar modes of action, advantages, disadvantages, etc. to their injectable counterparts with a few differences. What to do when a pill is missed is important for each category of OCPs and is shown in Toronto notes side boxes on page 515. The progestin only pill, that is the mini pill, has a pearl index perfect use of 0.5 and actual use of 3. General info points from Rupert Singh. Is considered a poor relative of the combined OCP. Norethine or norgestrel is common, and it takes the same time every day. It should be taken the same time every day with no breaks. If there's a missed pill, It's considered missed if it's more than 3 hours delay.